Fighting in Aden ceased just over a year ago, but the situation is still tense, as evidenced by the frequent influxes of wounded at MSF's hospital there. The most recent was on the 29th of August.
When we heard the explosion, we activated the mass casualty plan in the hospital to be able to receive the wounded. It took us 10 minutes to prepare everything, get everything set up. After that, the wounded started to arrive. We received 46 dead and 60 wounded.
While many of the town's hospitals have reopened and more medical care is available than a year ago, their situation is far from being stable.
We received thousands of wounded last year. Most of the hospitals here have been crippled by the war and are unable to respond to all of the healthcare needs. And often, the hospitals in Aden, both public and private hospitals, struggle to get what they need in terms of supply. The health sector here in Aden is not in good shape.
Some patients admitted by the teams in Aden have been referred from Taiz, a town about 200 kilometers away where it's harder still to get medical care. MSF supports several of the town's hospitals, including the one in Ataba.
Many of the roads leading to the hospital here are cut off or difficult to drive on. A lot of patients barely make it to the hospital. Several people have even died on the road trying to get here.
Ataba is a district with 30,000 inhabitants on the outskirts of Taiz. But with so few medical facilities, 100,000 people depend on this one hospital.